I'd been seeing multiple doctors with quite severe illnesses. I kept being told that I just had the flu or I just had a chest infection.
A belief that HIV is no longer a death sentence is encouraging people to be complacent about it.
Australia brought in very early in the HIV epidemic was to provide harm minimisation for injecting drug users, so providing clean needles, providing safe places.
Unfathomable. The idea of having to wear a condom during sex for any reason while two gay men were having sex was just not even outlandish, but so unnecessary. We couldn't get pregnant.
You know, if there is a risk, then people should test for HIV because the prognosis is very, very good.
How Much Do You Know is a podcast series that looks at HIV now. It's brought to you by Eastside Radio in association with Vive Healthcare. Dr. Catriona Ooi is a sexual health specialist based in Sydney's West, having worked overseas in Africa, Europe and all round Australia. Journalist Tim Brunero asks Dr. Ooi just why sex is still such a taboo topic.
Dr. Catriona Ooi joins me in the studio. She's worked in Nigeria, London, Parramatta, Gosford, Newcastle, Byron Bay, North Shore. She's seen it all and she's treated it all. Thanks for coming in.
Thanks for having me.
I want to talk about people who perhaps have an issue with being gay. We're probably at a period in history right now in Australia where being gay is perhaps easier than it's ever been in the history of humanity.
Yeah, I think that there is a lot more acceptance now than there used to be, but there is still a lot of stigma which surrounds being gay or coming out as homosexual. So depending on where you live, what your community's like, and also what your background is. So we see a number of people who come from overseas at the clinic I work at, and one of the reasons why they've had to leave their own home country is because of persecution because of their sexuality. So it is still alive, yeah, unfortunately.
So they come to Australia and they come to you because they've had a few issues. Can we walk through how being persecuted and escaping that for being gay doesn't necessarily translate to an outcome we might want to see in Oz?
Well, from the people that I've seen, they speak of a lot more freedom here, but knowing that there is that persecution can be very draining on them because a lot of them, their families are still overseas.
There is a group in our community, people who have sex with other men but don't identify as gay. Can we talk about them, please?
These are a hidden group, really. I mean, a lot of men might see themselves as heterosexual. They may be married and have children, but still have sex with other men. So there's that dichotomy between sexuality and sexual behaviour. And a lot of the people that I've met who fall into this category, they feel very conflicted. It's like they've got two lives. One is hidden from the other. Terrified about people finding out, absolutely terrified, and have been carrying this secret within them for a long time. So it can be very difficult. A lot of people in this situation wouldn't test regularly for HIV or sexually transmitted infections because they're concerned about their behaviour being discovered, and also because it's very difficult for people to test without at least admitting to someone their behaviour.
So they can't go to their family doctor, especially if that family doctor speaks their first language, is a member of their community in which they live and work.
Yeah.
If they're from overseas, they're recent arrivals in the last 20 or 30 years, let's say.
Yeah. But a lot of these people aren't recent arrivals. You know, they're your average Aussie bloke sort of thing. And their GP might be the same one that sees their wife and their kids, who might have treated them from when they themselves were young, or might see their parents or their brother or their sister. So there's a real fear of breach of confidentiality.
Yeah, I bet. And that would be a tough situation. Talk to me about their sexual behaviour when they do choose to sleep with other men, how that might be riskier or different to someone who's out and gay or bisexual.
I guess in some ways what makes it riskier is there's less awareness for some people about safe sex practices and the risks involved with different sexual practices. A lot of the sex they may have would be anonymous, so it's one of those opportunistic sort of things. And so they may be having anonymous sex, so you don't know the person they're having sex with and they don't know what their risk is. They might not be carrying condoms with them, for example, because, well, why would I have condoms if I'm married and have kids? So there's a fear of breach of confidentiality there. So there may be more of a chance that they'd have unprotected sex.
And I suppose it's as simple as not being in a sort of gay community sometimes. If you're gay, you're mixing with other gay people, they're sharing information about risky practices and just general information about HIV, but also you're just getting those sort of messages because they're talking to you.
And then not unfamiliar topics either. I mean, a lot of people might have friends or family who are gay or who have HIV or who are on treatment. And so that debunks a lot of the stigma and the myth around it all. But if you're not in those conversations, then it's all completely unknown.
How do we reach those people?
Yeah.
Men who have sex with other men but don't identify as gay.
See, that's the golden question. That's the question a lot of people have been grappling with for ages. How do you do that? I mean, do you do a community-wide campaign? We saw the last one, which was the Grim Reaper campaign. I mean, that caused a lot of fear and stigma and discrimination in the community. And most people I speak to who are of a certain age can remember that. I mean, I was a kid and we all remember that. It caused a huge amount of fear, and that's not productive.
I know that, from speaking to people in this space, that one of the tough things about an HIV diagnosis is that it's kind of a triple whammy because it's an infection, but it's also sex-based and it's also is a marker of being gay.
There are a whole lot of different issues that it raises. And we've given HIV diagnoses over the years. It's part and parcel of what I do. And people react very differently. It's quite amazing how the responses can vary from, oh, okay, and you're kind of thinking, did you hear me? To someone who completely becomes acopic. And you can never say, oh, so-and-so will deal with it well, or so-and-so won't deal with it well, because you never quite understand where somebody's coming from. Sure, you can empathise with someone, but you can't walk in their shoes and you're not in their position. But you're right, there are a whole lot of different issues that are wrapped up in that diagnosis. Talking about sex has always been taboo. I mean, you meet people, your friends, you go out for dinner. Well, a lot of my friends, we do the same thing, so we always talk about this sort of stuff. But it's not something that you talk about. And if it is a subject that's raised, it's not in those terms.
I wanted to talk to you about treatment because there are some prophylactic remedies that people can take but might only be aware of if they are in a community where they're getting the messages. Can you talk to us about that?
Yes, we've entered a new age in chemoprophylaxis, you could say. So we've got PEP. We've had PEP for a while. That's post-exposure prophylaxis, which is HIV medication within 72 hours after exposure for a month. And now we've got PrEP, which is pre-exposure prophylaxis, which is ongoing medication to prevent HIV if you do come into contact with it. Now, at the moment in New South Wales, we've got a trial going on which aims to recruit nearly 10,000 people for PrEP. But these are particularly high-risk men, so you have to satisfy certain criteria that you are high risk enough to take it, because you have to balance up the risk of HIV with the side effects and risks of medication.
What are those risks?
So there are eligibility criteria for the trial, and if anyone is interested in going, then they should probably go and see one of the sites that are enrolling. But they include things like unprotected receptive anal sex, the fact that you're going to have unprotected anal sex receptive. You might have had an STI in the past, a rectal infection, which means that, yes, you have had unprotected anal sex. So those are just two of the examples of eligibility criteria. And these trials, there's one in Victoria, they're starting one in WA and in Queensland as well. So it's nationwide.
And it's working?
Yeah, it seems to be. If people are taking the medication, it works. The biggest issue they've had, and this is from studies overseas, is that where it hasn't worked, they've found that people aren't taking the medication as prescribed. It's an incredibly dynamic field. We've gone from the mid-80s where it was basically a death sentence, and from diagnosis to death you were looking at a matter of years, to today where people who are HIV positive, on treatment and well monitored, they've got a lifespan approaching somebody who's HIV negative. So it's pretty exciting.
Can I just finish by asking you, if you are a man who has sex with other men, but identifying as gay or talking about that behaviour is problematic for you, can you give us a couple of quick ideas for making yourself as safe as possible?
Okay, so first of all, avoid risky behaviours. Not always 100% possible, but where you can, use condoms, lube. If you are concerned that you've been exposed to HIV, then go and access PEP, post-exposure prophylaxis, and you can get that at emergency departments or sexual health clinics. If you're worried, there's a PEP hotline also, and you can just Google that. If you're wanting to get a test for HIV, simple, you can go to a sexual health clinic and you can be anonymous. So you can use any name you like. We've got a couple of Madonnas on the book.
And of course, as long as you give them a phone number, one assumes that's all you got to do.
Yeah, we just need some contact details in case. We're incredibly discreet and, you can tell us anything. And quite frankly, we've probably heard it before.
Yeah.
So there's no shockability there, which makes it easy for some people.
Thank you so much for coming in and shedding a little bit of light on it for us.
My pleasure.
HIV is now no longer the grim reaper it once was. And even if you can't avoid high-risk behaviour, there are ways to prevent transmission or effectively reduce its impact if diagnosed. It's incredibly important that everyone knows a lot about HIV now, given the prognosis is very good. Head to health.nsw.gov.au for a full list of sexual health clinics throughout the state, or call 1800 451 624 today. You've been listening to How Much Do You Know, a podcast series on HIV that is brought to you by Eastside Radio in association with Vive Healthcare. To hear more on the series, head to eastsidefm.org/howmuchdouyknow.